I'm going to begin by just putting a few facts out there that I feel should be heard by everybody other than it coming from my mom, who at the time of this whole ordeal was sick, was basically on her deathbed the entire time we were in DR. The day of her surgery, my mom, it was normal, whatever. Medina was supposed to come in and have a brief session with us and just talk to us about the surgery and everything like that. She never came in. We never saw her that morning. My mom, two nurses came in, got my mom, wheeled her out, and I didn't see her. My mom went into surgery before other patients, and those other patients that went in after her were coming up to the recovery room before my mother. I was left in the dark about my mom for 6 hours. When I asked the nurse, she said, Medina will be right in. It only took another hour for Medina to actually come in and explain my mom was in a separate room downstairs because she's taking longer than others to wake up from surgery. That is where I knew we were in for something that I was not going to enjoy. Here it says on her site that she came in and explained everything that was going to occur in the surgery and everything she should expect post-op. That's a lie. You never came in. We never saw you. Nothing. You weren't there. We didn't see you. I didn't see you until 6 hours after the surgery, and you only came in because I kept insisting and asking nurses for answers. Where's my mom? What's going on? Is she okay? Like, no one came in the room. Mind you, I'm at the time, I believe, 18 years old, alone in another country with no one else. I'm alone, and I'm asking for answers, and I wasn't getting any. She says, after surgery, the day after, she says, the patient's hemoglobin is monitored, which presents low levels. Dr. Medina indicates the immediate need for blood transfusion and hyperbaric chamber treatment. This is a lie, because after the surgery, we stayed one night and were driven to the recovery house. We did not see, hear, or speak to Medina in 3 days until my mom's follow-up appointment. So how, the very next day, did you know that my mother's hemoglobin levels were monitored? Because they weren't. No one came into the room. No one monitored her. The only thing that was occurring in the room was her medicine, and even those were being given to my mom late. They were never on time. The nurses were never in the room until I had to call them, which was every single time. My mom was in pain. Every time my mom looked pale and sick, I called the nurses, and that's the only time that they would come in. They were more worried about, oh, what do you want to eat? What do you want to snack on? It was never worried about my mom or the state that she was in. So that's a lie. There's no way that the tests were taken to know that my mom's hemoglobin levels were low. Let's start there. Then she says the patient is cited by the doctor again that a blood count is being performed showing even more decrease in hemoglobin levels. That's a lie. You took these tests, which let me let you know now that these people take your blood, they do these tests, and you never know the results of them. Not once did we get the results from these tests, which we asked multiple times. Let us see the paperwork. Let us see the paperwork. Oh, you'll get this soon. We're going to print it out. Oh, we're backed up. Our office is down, which let me remind you, my mom had her surgery performed in another location because her location had been infected, had been the ceiling, it was infected. So there was bacteria all in her surgery offices, and that's why my mom had to have her surgery in a different location. So here it says that my mom was cited by the doctor. Well, let me tell you something, because my mom was not even coherent to even understand what was going on. I was presented with all this information, and Medina now once said to me, like a normal doctor, listen, your mom is not doing well. We need to perform extensive treatments or whatever the case is. Not once did she ever sit me down and say that. You know what she told me? To my face as an 18-year-old. If you don't give me more money to fix this, your mom is going to die, and that's going to be on you. And I'm sitting here by myself with no more cash, no more money that I can possibly give this woman. And I'm looking at my mom on the table with some woman rubbing a cream on my mom, literally pushing on my mom's stomach where they just performed surgery. My mom's screaming out in pain. They don't care because it's normal. It's a part of the procedure. And I'm looking at this woman stone cold, does not care. about how I'm going to come up with the money. I asked her, how do you think you need to call someone in the States to send you money. Ask your dad, ask your family to send you more money. We need more money or else we're not going to do anything else. So you mean to tell me that if my mom dies, it's on me because I can't give you more money? This is all a scam. She could have treated my mother early. She could have treated my mom before anything had started. Did she come to the house, the recovery house, to check on my mom? No. Did she call to check on my mom? No. So then 3 days later, you want to say my mom's dying and it's my fault if I don't give you money to fix anything? That's not how it works. That's not how you call being a transparent, protective doctor. That's not what that is. Then you say here, she's notified that her life could be in danger. No, you straight up told me my mom's going to die and it's going to be my fault. So there's that. And the patient refuses again and signs a second consent document. Then you said the doctor is notified that Mrs. Ramos fainted. My mom was not even, like I said, coherent, guys. My mom was not my mom. My mom was in pain. My mom was in and out of sleep. Every time my mom was up, she was either throwing up or making sentences that didn't make sense. Like, it wasn't my mom. My mom wasn't all there. So she had to be awake for her to faint, okay? Her not being coherent was it. So it says she's transferred to sleep and agrees to be transfused. Although the damage to her skin was already done due to resistance to having received the transformation in due time. So if it was already damaged, what was it going to do then? Why make my mom could pay all this money if you knew it was already done and damaged? So you telling me you did take my mom's money after knowing nothing else could have been done? You're basically saying that, yeah, her skin was already done, it was already too far gone, but you still took her money and you still made her to go through all these painful treatments, right? Okay, the patient is transfused to increase the ability to transport oxygen. Mind you, once we got to the place of the hyperbaric chambers, the doctor looked at my mother and asked, who did this to you? Why did she do this? Why do you look like this? This isn't okay. The doctors at this treatment facility knew something was wrong with my mom. They knew that it was bad. They knew it. And they basically protected my mom and were on her side and were saying, Medina is doing something wrong. She did something terribly wrong to you and you're gonna suffer for it. And it's saying here, disregard the doctor's recommendation and good professional practices for these cases. She voluntarily discharged to return to her country. Medina, we had maybe 2 or 3 appointments with you, and every single time we were on time, you were the one who were late, and every single appointment was rushed, and every single appointment was, oh, put cream on it, she'll be fine. Put cream on it, she'll be fine. Put cream, she'll be fine. How is putting cream on an affected necrosis area fine? Then you put her in a faja that's 2 sizes smaller than what she should have been in, which had her bleeding out. The first faja was covered from her chest to her toes in blood, in complete blood. Oh, that's how it's supposed to be. She's fine. She's fine. Yeah, my mom is going to leave DR to go to America to get professional help to save her life because she's dying. So why do you think that someone's going to stay in your country when you don't call, you don't treat them with respect, you don't treat them at all? You have your nurses come in and rub lotion on my mom and then you leave the room. You see it's my mom, you would come in, you would be like, okay, put the lotion on, and you would leave the room. That's all you ever did. So stop sitting there and acting like you were this great doctor, because you're not. You're not. Okay? And then it says, she continued communication through digital contact. The doctor tries to offer help and informs the patient that the right thing would be to return to the Dominican Republic to treat her. The patient again ignores the recommendations and decides to enter a health center in the United States. Medina, anybody that is dying in another country would want to go back home and get professional medical attention, okay? Why would you offer someone that's already in the United States? You know you did something wrong. You know it, because every time we would send you a picture of my mom's stomach, we have proof, Medina, we have proof. You would tell my mom, it's going to get better in months, my dear. You need to be patient. This is going to take a long time to heal. Knowing that my mom's stomach and her skin is dead. You know that it's dead. You know that the skin and tissues are dead. Okay? My mom had to have numerous of surgeries to have all that skin removed. I was the one that had to sit there with gauze and medications and taking care of my mom. There was a hole that was almost 6 inches deep inside of my mom. The hole was like this. And I was the one who had to take care of my mom. I was her nurse. I was her doctor. I had to take care of her after all of the malpractice that you performed on her. But then again, my mom is the wrong one. My mom is in the wrong for protecting herself and going to America to get professional help after you're lying to her face and you're taking her money for blood transfusions, for hyperbaric chambers, for tests that didn't need to be done. You were taking vials of blood, and not telling us what was happening. Where are the results? Oh, we don't know. Why is this happening? Oh, this is what. Everything is just a scam. You just take people's money and you're scared because it's the first time someone's coming to you with true facts. You are sitting here writing a response that are filled with lies. Okay, we have the texts, we have the call logs, we have the paperwork. You know what you did. You know what you did. Okay, sitting here, any normal person is gonna block all communication with you when you try to take their life. No one's gonna want to have a conversation with you. Okay, why would you ever tell my mom to hop back on a plane for you to touch her again when you tried to kill her twice and you didn't care? You didn't care. You just wanted her money. And sitting here and you're saying here that her activities include the opening of YouTube, Instagram channels, publication of misrepresentative content, paid advertising, and even death threats to the family. When have we ever sent death threats? We are not those kind of people. We don't run on that time. We don't have the time to do that. We're not animals, okay? We know that's how you operate. We know that, you almost kill people and don't take accountability, but we don't do that. We seek justice and we seek the truth. So for you to sit here and say we sent you death threats, that's low. And that's even low for you. So please, every single one of these posts, there's a lie. Every single one of the case chronology posts, they're all lies, and you know it. So you're sitting here and you have someone coming behind a screen and writing on things they have no idea about. You're sitting here and you're forgetting that hours after my mother's surgery, you sent in a massage therapist, okay? You sent in a woman 3 times the size of my mother. She comes in, doesn't say hello to me, doesn't tell me who she is, puts a bag down, picks my mom up from the bed, okay? Can you imagine this, everybody? After a full tummy tuck and BBL, okay? My mom is in a faja that's 2 sizes too small. She picks up my mom from the bed like this and throws her on a chair, okay? My mom is covered in blood. My mom's screaming out in pain, and this woman is laughing. The woman is laughing in my mother's face. Oh, she's dramatic. This is normal. You have to be stronger. You're gonna get through this, blah, blah, blah. She rips off my mom's faja, okay? Doesn't wipe down her blood, doesn't clean her off. She bends her over. She bends my mother over on a bed hours after a tummy tuck. Bends my mother over and starts to push on my mother's back. Push and push on my mom. And she's putting all of her weight on my mom. All of her weight. Now, if I had a picture of this woman, I would show you, because she was probably 6'2", and that's being kind. 6'2", probably close to 200 pounds, was putting all of her weight on my mom. And my mom is 5'2", the tiniest little frame, just got out of surgery, is in pain, bent over, and blood is spewing out of here as she's pushing out, okay? This is normal, okay? After that, my mom was plopped back into bed, literally picked up and dropped back in bed like an animal. And I noticed my mom is not coherent. She's not making sense. She's in and out. My mom is pale. My mom is frozen. My mom, it was literally looking at a ghost. That's how my mom looked. And I asked nurses several times to please come in, please come in, please come in. Hours passed and no one came in, until one nurse finally, was probably fed up with me, came in, brought in a brown bag and connected it to her IV and said, this should help her feel better. I said, what is that? Oh, vitamins. What are vitamins going to do for my mother at this point? Like, what are they going to do? Okay. So she mentions how, the very next day her hemoglobins were low. Okay, let's talk about how you never even came to the recovery house. Not once did you show up. And let's also talk about how you put her on the top floor, knowing that she just got a tummy tuck surgery. My mom was struggling to climb every single step. And your nurses were pushing my mom. Oh, come on, like, you're fine, go, walk up. These nurses don't have any sympathy. They don't have any compassion in their hearts. They don't care because, again, they work for her and they're on her time. My mom was placed on the top floor of this recovery house, okay? She couldn't walk up any steps. Mind you, 2 or 3 days later is when we had our first appointment. Her driver shows up, doesn't help my mom to the car, doesn't have any communication. My mom sits down, and when you have these surgeries, you are supposed to drive with the utmost care and respect for the patient that's in the car. This driver was reckless, hit every single bump, almost got in 3 accidents in the first drive, doesn't even say I'm sorry, speeding, everything. My mom was screaming out in pain. And did he want to apologize? Did he want to say I'm sorry? Did he want to say I'll drive better next time? No, we had the same exact driver, and every single time, George, every single time he came, he was hitting every speed bump. Again, almost hit people, almost hit other cars, just reckless. The most destructive drives I've ever been on in my entire life, okay? In the recovery home, the nurses never gave my mother her medication on time. I always had to give my mother her medication. I always had to remind the nurses to come in and change her sheets or help her with her faja or wash anything I needed. It was too much for them. I was a nuisance, basically, okay? Like I said, instead of explaining to me what was really happening, what was really occurring, she again made me dish out money, and my family dish out money to buy creams for the necrosis, okay? The creams were supposed to correct what had already been done, and as we all know, you can't correct dead tissue. No cream is gonna make that come back to life. Like, there's nothing that's gonna work for that, okay? So when my mom did get the blood transfusion, we showed up to the Cecily. And when we got there, this man came and he, informed us about the procedure, whatever was going to be done. We were brought upstairs. Now, once did he mention that he was her husband. Now, once did he mention that they all work together and that, they're all in cahoots with everything. It's all a money ring. It's all just to get money, okay? It was her way of getting the extra money. We get there, her husband, that we didn't know yet, was changing my mother's bedpans, okay, was extremely rude. My mom was so uncomfortable that this man was being so aggressive with her, and he just had no sympathy for the pain that she was in as well, okay? He had no cares. He only came in one time to check on my mom with the whole blood transfusion. And it's just funny. It's funny to know now that that was her husband, okay? It's funny to know now that that was her husband. The day that we were leaving, because it says here in her thing that my mother signed a consent form to leave the country. My mom was waiting to have an appointment with you, okay? And again, we need more blood. We need more blood. Okay, after being in pain for almost 2 weeks, okay? And knowing something is not right, and you tell my mother to her face again, you need the creams, just rub the creams, we need more blood work, this and that. What else was my mom supposed to do, okay? On the very last day, it was raining. Her office was filled with all these patients, okay? Filled. And I remember so vividly, it was a doctor's birthday. Everyone is coming out the rooms and singing this doctor happy birthday. They're cutting cake in front of all their patients in the lobby. No one's paying attention to anyone. No one's in the proper help. Mind you, there was other patients on the couch that looked... I was scared for them as well as my mother. I'm looking at them like, what is this woman doing to these people? She's laughing and talking, and every time I asked, can we be seen? It was, we're doing this, we're cutting a cake, we're doing this. Who does that? What professionalism and transparency do you have? That's not how you run a business. That's not how you do things, okay? And on the very last day when my mom said she wanted to come back home and come to America, do you know what she said to my mother? Okay, no problem. Print out the form, she can go. We never saw Medina again after that. She went to her office to look at somebody else, never spoke to my mom again, never said anything, never said I'm sorry, never said, how else can I help you? How else can we make this work? It's give her the paperwork. If she wants to leave, she can leave. That's on her. That's what you said, okay? It wasn't until we got back to America, my mom was sending you the pictures of her stomach and telling you that she's going to the hospital for help. That is when you panicked. That is when, oh, my Barbie, come back, my dear, I'm so sorry. No, a little too late for all of that. Okay, once my mom had 2 surgeries, had to go to therapy for months, wound therapy for months, okay, and my mom recovered and it was her time to speak her truth, that is when you wanted everything to be halted. That is when you wanted everything to be done on your time. You spread lies about my mom. You spread lies about my family, okay? And the minute that someone puts you out on your lies, you were too comfortable. You were too comfortable sitting in your position of, oh, no one can touch me, no one can do anything. No. Okay, we're going to be here every single time you want to tell a lie, every single time you think that you have the one up. No, trust me. We have the proof, we have the documents, we have the screenshots of every single time that one of my friends or my family members DM'd you and asked you what happened. Oh, my dear, what happened is and you blocked every single one of us. You blocked every single one of my mom's supporters, and you were saying here that my mom is on a media frenzy. No, it's to warn people. It's to warn people not to go to you, because you are literally burning people. You're giving them necrosis. You're giving them health problems. My mom has never been the same. Has never been the same. She can no longer walk the same. Her body is scarred horribly. It looks like someone just went in there with their eyes closed and started cutting my mom, okay? She has never been the same mentally. She has severe anxiety, severe depression. She is constantly crying. She's constantly in pain, constantly having stomach spasms, okay? My mom has never been the same, ever. And for you to sit there and say my mom is a liar, you have children. You have children. What if someone did this to you? What if you killed my mom? What if she left 3 kids and a husband and you didn't care? The only thing you care about is your clinics being taken down, is your name being dragged through the mud. Which, guess what? I'm gonna do that. I'm gonna continue to spread the truth. I'm gonna continue to let people know that you're a liar and that all you do is take everyone's money and you shut people up. You're really good at that, and you're really good at paying people off to take down reviews about you. Everyone's so quick to judge and assume, why didn't you look her up? Why didn't you find more details about her? You want to know why? Because her posts were taken down. People's information about her were taken down. She paid people to take down their posts and their truths, okay? She likes to quiet people, but we're not going to be quiet. I'm not going to be quiet, and I'm going to sit here and tell you the truth, okay? You're going to be taken down, Medina. You're going to be shown that you don't almost kill people and get away with it. So yes, thank you for your beautiful response website that does absolutely nothing, that makes absolutely no sense, that has absolutely every single lie in there. Every single post in your case chronology makes no sense. And we're going to call you out on your stuff every single time. So everyone, I want to thank you for the support. I want to thank you for being there for my mom. I want to thank you for constantly sharing her page and reposting everything. I know that me speaking, it was coming from all different directions, but as a daughter of someone who almost died, you don't always want to speak about these things. I don't speak about my mother's, about that time in my life, because I was alone, I was by myself, and it was traumatic, and those are things I wish I never had to live through, and things that I wish I never had to go through. And for Medina to sit there behind a screen and continuously operate and continuously feel like she can say or do whatever she wants and continue to receive those checks, no. You're not going to almost kill my mom and get away with it. That's not what's going to happen. So if I have to speak out, if I have to put myself out there, if I have to speak my truth, I will do it. And that's that. So thank you. And I promise to keep you guys updated. And anytime I feel like she's out on a lie, I promise to post about it, show you the truth, show you the documentation. And just stay tuned, because there's going to be more videos, there's going to be more posts, and we're going to show you guys exactly who Medina is one way or another. Bye.